This content is for informational purposes only and does not replace professional medical advice. Always consult a qualified healthcare provider for personal health concerns. Did you know that nearly every man will experience changes in his prostate health if he lives long enough? It is a startling reality for many, yet it remains a topic often shrouded in silence or unnecessary anxiety. While most people only begin to think about this organ when something goes wrong, understanding its function is one of the most proactive steps you can take for your long-term wellness. Many men fear the mention of prostate enlargement, often assuming it is a precursor to something far more dangerous. However, medical professionals clarify that benign prostatic hyperplasia, or BPH, is a non-cancerous condition linked to the natural aging process. It is not a disease in the traditional sense, but rather a structural shift in how your body operates over time. Research suggests that as hormonal balances fluctuate throughout adulthood, the cells within the prostate can gradually multiply, leading to the physical growth of the gland. You are certainly not alone in this experience. By choosing to learn about the mechanics of your own body, you are moving away from the uncertainty that often fuels stress and toward a position of informed advocacy for your own health. Think of this journey as a way to demystify a part of your anatomy that you have likely ignored for decades. When you understand why these changes happen, the symptoms, such as changes in urinary flow or frequency, become less about sudden panic and more about recognizing your body's signals for adjustment. We are going to move beyond the myths and look at the biological reality of how this gland functions, how it responds to the passage of time, and why your awareness is the most powerful tool you possess. Now that we have established why this small gland demands our attention, let us look closer at its specific biological purpose and the intricate system it supports within your body. To understand why this walnut-sized organ commands such significance, we must first visualize its place within the male pelvic anatomy. Think of it as a gatekeeper positioned at the very exit of your bladder. Its primary biological mandate is reproductive. It secretes a specialized fluid that combines with sperm to form semen. Without this glandular contribution, the reproductive process would be far less efficient. However, the prostate is not a static organ. This brings us to the phenomenon known as benign prostatic hyperplasia, or BPH. It is essential to clarify immediately that BPH is not cancer. Imagine a small room that begins to shrink as the walls slowly move inward. Because the prostate surrounds the upper portion of the urethra, when it grows in size, it begins to exert physical pressure on this canal. As the gland pushes against the urethra, it creates a bottleneck, which is why many men notice a change in their urinary habits. You might feel as though your bladder isn't fully emptying, or you may find yourself waking up more frequently during the night. Studies indicate that BPH is an incredibly common part of the aging process, affecting a significant majority of men as they reach their 60s and 70s. It is not a sign of failure or an inevitability of poor health, it is a biological reality of the male system. Medical professionals emphasize that while the growth itself is benign, the symptoms it creates can impact your quality of life. Now that we have mapped out the anatomy and identified why this enlargement occurs, we need to examine the specific signals your body sends when the prostate begins to undergo these changes. While we have pinpointed the mechanical reality of how this walnut-sized organ interacts with your bladder, the more pressing question often arises: why does it choose to grow in the first place? To understand this, we have to look at the intersection of time, biology, and the complex chemical environment within your body. As men move into their 50s and beyond, the prostate undergoes a natural transformation. It is rarely a sudden event, rather, it is a gradual, decades-long shift that many men will encounter at some point in their lives. Specifically, the relationship between testosterone and dihydrotestosterone, or DHT, becomes a focal point. While testosterone is the primary male hormone, DHT is a potent derivative that can act as a catalyst for cellular activity within the prostate. Beyond the clock, your genetic blueprint carries weight. Studies indicate that if your father or brothers have dealt with significant prostate enlargement, your own likelihood of experiencing similar changes increases. It is not just about the code you were born with, but how that code interacts with the environment you live in. We also observe that lifestyle factors and metabolic health might play a nuanced part in this expansion. It is a complex interplay, and while we cannot stop the passage of time, understanding these drivers helps take the mystery out of what you might be feeling. The demographic most likely to notice these shifts typically includes men over the age of 50. It is a standard part of the male aging process, similar to graying hair or changes in vision. Recognizing that this is a widespread, well-documented biological progression can help shift the perspective from one of alarm to one of proactive management. Recognizing these early warning signs is the bridge between simply noticing a change and taking the necessary steps to restore your daily comfort. As we move from understanding the biology of the prostate to identifying how it impacts your daily rhythm, it becomes clear that your body is a highly communicative system. When the prostate gland begins to increase in size, it doesn't usually happen in silence. Think of this as a garden hose being slightly pinched. The flow is no longer as free as it once was, and the bladder must work significantly harder to overcome that resistance. The most frequent signal men notice is a change in the character of their urination. This is often accompanied by a sense of incomplete emptying, where you feel as though your bladder isn't truly finished, even moments after you have walked away from the basin. Research suggests that this sensation arises because the bladder muscle, known as the detrusor, eventually fatigues from constantly pushing against the obstructed outlet. Beyond the flow itself, you may notice a shift in urgency. It can be quite disruptive, especially when you are out in public or mid-conversation, as the bladder becomes hypersensitive to even small amounts of fluid. This urgency is frequently coupled with frequency, the need to visit the bathroom far more often than you did in your younger years. Perhaps the most exhausting symptom is nocturia, the persistent need to wake up multiple times throughout the night. Studies indicate that this occurs not just because of the physical pressure on the bladder, but because the interrupted sleep cycle can affect your overall energy levels and mood. It creates a cumulative effect, where the physical discomfort of the prostate's growth begins to bleed into your mental well-being and productivity. There are specific indicators that the anatomical balance of your lower urinary tract has shifted. While these changes are common, they are also highly manageable once you have a clear picture of what is happening. Now that we have mapped out these physical indicators, we can move forward to discuss how these symptoms are categorized and what they typically reveal about the current state of your health. Moving from those initial observations to proactive management is where you regain your sense of agency. When we talk about prevention or slowing the progression of these changes, we are really talking about creating an environment in your body that is less conducive to inflammation. Research suggests that dietary adjustments can be remarkably effective. Reducing the intake of red meats and highly processed sugars is frequently cited in studies as a way to lower systemic stress, which may indirectly benefit prostate health. Staying adequately hydrated is equally vital, though balancing your fluid intake, especially in the evening hours, is a practical strategy many men use to reduce nighttime interruptions and improve sleep quality. Regular, moderate exercise is linked to better urinary flow and reduced pelvic tension. You don't need to train like an athlete. Consistent walking, swimming, or cycling keeps the pelvic floor muscles engaged and promotes healthy circulation throughout the lower body. For many, the first line of defense involves medications that help relax the smooth muscle in the prostate and the bladder neck, making it easier to empty your bladder. Other classes of drugs work to shrink the prostate tissue itself by influencing hormonal signals. When medication is insufficient, we look toward minimally invasive procedures. Technology has advanced to the point where we can often address obstructions without the need for traditional, intensive surgery. These options are designed to preserve your quality of life while addressing the physical blockage head-on. The path forward is rarely one-size-fits-all. By combining these evidence-based habits with modern medical support, you are not just waiting for things to change, you are actively shaping your experience. Let's look at how you can monitor your progress and when it is essential to seek a more comprehensive evaluation. Looking toward the horizon of urological medicine, we are entering an era of unprecedented precision. Where we once relied on broad-spectrum medications or invasive procedures, researchers are now unlocking the potential of targeted focal therapies. Innovations like steam ablation, which gently shrinks obstructive tissue without the need for traditional incisions, are becoming increasingly accessible. Furthermore, advancements in genomic testing are helping clinicians distinguish between slow-growing conditions and those that require more aggressive intervention, sparing many men from unnecessary procedures and their associated side effects. These breakthroughs represent a shift toward personalized care, where the strategy for your prostate health is tailored specifically to your unique biological profile rather than a one-size-fits-all approach. As you integrate these insights into your life, keep the core principles of prostate wellness at the forefront. The path to maintaining your quality of life is built upon three foundational pillars: consistent physical movement, a diet rich in plant-based antioxidants, and an open dialogue with your healthcare provider. You are not a passive observer in your own health journey. By choosing to prioritize these proactive habits, you are effectively shifting the odds in your favor. The most significant takeaway is that early detection remains your most powerful tool. The prostate does not always signal trouble with clear, urgent warnings, which is why periodic screenings are not just a medical recommendation, they are a form of self-respect. Making these checkups a standard part of your health calendar provides you with a baseline for comparison, allowing you and your doctor to identify subtle shifts before they evolve into significant concerns. Do not wait for symptoms to disrupt your daily routine before deciding to take action. A simple, routine visit can provide the clarity and peace of mind necessary to continue living your life with confidence and vitality. This content is for informational purposes only. If you found this information helpful, please consider sharing it with someone you care about, as spreading awareness is a simple yet profound way to support the well-being of the men in your life.